Hey guys, welcome to the Veterinary Ledger podcast. This is where we do a deep dive into the business of veterinary medicine. We say each week we're trying to explore strategies that are a little bit looser in the summer right now. We're taking a break, but this is where we're going to talk about insights and stories that help practice owners, managers, and teams run a thriving, efficient, and profitable clinic without losing sight of the pets and the people they care for. So whether you're looking for practical tips, expert advice, or a fresh perspective on veterinary business, you have come to the right place. We are super excited today, as always. So Erin Abrahams, you are Dr. Erin Abrahams, Calico Veterinary Clinic in New York City, which is super exciting for me. Look at this view, guys. This isn't even, for those of you that are watching us, this is not even a screensaver. This is just her real life, which looks lovely. You are doing things that no one else is doing. You are feline-only dental. How's that working out for you? Tell us how you got here.
I was drawn to dentistry in vet school. I took all of the extra labs that I could. When I graduated, I flew down to Florida a few times. I would shadow boarded dentists. And after I served 3 years in the Army, and after that, at that point in time, had intended to start a mobile kind of per diem dentistry service. I actually had a business loan. I think I was approved for like $45,000 at the time,
This is going to get you where?
which
I don't
is
know.
such a small amount of money. And I was just going to be going from clinic to clinic. I don't know what, but at that time, my mentor, Bill Rosenblatt, reached out to me from MSPCA Angel in Boston. I was hired as an associate in their dentistry department to handle their general medicine cases. So at Angel, they have a general medicine department, just your everyday family vet. And so I would take care of those patients while Bill and the other board dentists would take care of referrals that were referred from outside and some inside cases as well. And that just continued on. And I actually thought about changing careers mid-pandemic. I tried to move to Colorado and somehow ended up still staying on the East Coast, was drawn back to Boston for a little bit, and then there was a posting for a position in New York for dentistry, per diem dentistry, and I thought, okay, never ever considered moving to New York. I actually really don't want to move to New York, but we'll give it a try. And I interviewed during COVID, double masked, terrified to be in the city, and got hired. Spent only about 3 or 4 months at that practice because it's all word of mouth, right? Somebody had overheard me say that I would love to work with cats. If I have cats on my schedule, I'm happy. And she put me in contact with a feline hospital in the city. And I spent 3 years doing all of their dental cases for their in-house patients. And halfway through that time period, realized that the one doctor that was practicing wasn't enough to support me for a full caseload. So I reached out to another feline practice in town who doesn't do any dentistry. And so they were sending me cases. So that was 3 years. And then that practice that I was working at was sold. And this just happened. It was I will go as long as I can go until something stops me, and nothing has stopped me.
Nothing
So
can stop you. I mean, there's lots of cat mounts out there, especially in the city, right? Like it's the perfect demographic.
it is. It really is. There are several dental only facilities, one other GP practice, and now 3 practices with boarded dentists. But yeah, there's enough out there in this city for all of us, fortunately.
That's a journey. That's quite a journey. And I'm more interested. I wrote down a bunch of notes. You mentioned 3 years in the Army?
Yes.
What experiences, how did that shape where you're at today?
I was responsible for a unit. I was a captain. So I had anywhere from 12 to 15 soldiers and civilian employees, split between veterinary medicine and food safety. I had 2 clinics, one that had been open full time. The other, our obligation, I think, was to do a vaccination clinic once per month. And over my time there, that I fully staffed that clinic. And so we went from being open one day a month to being pretty much full-time, fully staffed, open, I think 5 days a week. I don't know what I looking back, I don't even know what or how I did that. I had an amazing support network. One of my soldiers who I'm still in contact with today really got me through and supported me through that. She was not a technician. She was actually a food inspector, but she's so great. She would interview with me. We were interviewing for, vets and support staff. And so that was helpful. Even though I don't really remember the details, I would just know that I've been there, I've done something. I honestly did not like my time in the Army. It was not for me. It was a mixed bag for sure. At points I wanted to give the money back. I'd gotten a scholarship and that was my service, in return for my scholarship. And a few times I thought, can I just give you the money back? But I got through it. As my colleague says, I can do tough things. I can do hard things. Got through it and went on to Angel. It was a big leap going from military to back out into the world of veterinary medicine because I had very limited resources, very limited caseload. I did not have an x-ray machine in the clinic. If our primary mission was to take care of the military working dogs, if they needed x-rays, we would have to go take them to the human hospital to use their x-ray. So I felt like I was behind the ball for sure, especially going to Angel where I had a 6-hour interview with 7 or 8 different people. Definitely some big imposter syndrome, but I got through it and here I am today.
Well, now you can work feast or famine, right? You've got both. That's kind of like, are you running your crew now like a brigade, or you were doing the opposite and that is not where I want to be, so now I am the opposite of all of that?
There isn't really a crew at the moment. I have one remote team member. She works from Paraguay. She does all of the client-facing communication, answers phones, emails, keeps me on track. And I haven't been busy enough yet to need a full-time staff. I actually started with a few employees and realized didn't have enough work. And so I've just been working with per diems since April, which has been really amazing. There have been some glitches. There have been some scheduling issues. I've had to cancel because the tech didn't show up, or I've had to pay a tech because I didn't have a case. But it's all part of the process. And currently I have one relief tech who is pretty much available. She's, this is where she wants to be. So we're both living that per diem life, and which I enjoy. I just had a new baby nephew born, so I'm able to go visit family, and it's working. My labor costs are down. I don't pay myself yet. So it's nice to have the flexibility and not have the structure of employees. I did that for the first half of the year, and I learned a lot, and I want to get back there for sure, but take my time. I've learned a lot of lessons, and right now we're in the perfect spot.
Good. I'm glad to hear that.
Were you nervous hiring remote for that position? How's that gone? Has there been any bumps in the road? Would you do it again that way? It sounds like it's been successful.
Yeah, no, it's through a company called Team, TEEM. I actually was thinking, you guys, I don't know if you've approached that market. I think there are several companies that it's big in the human dentistry, and they're getting into the veterinary market. She was my first hire. We interviewed, and I was just within 10 minutes of the interview. She had accepted the position. She's been with me since May 5th of 2025, and I could not do it without her. She's been my biggest help, resource, supporter by far. Thank you, Isabella.
I remember I was skeptical when I first talked to you, and you're like, "This is what are you gonna do?" And I was like, "All right,
It's great.
Good.
It's great. The time difference is only an hour, 1 to 2 hours, depending on daylight savings. And it's just been, she's lovely. My clients comment on how lovely she is. And so she really helps me run smoothly.
So, like, every step you've been so intentional. And we talk
Yeah.
about, cats aren't just small dogs, but you put so much thought and effort into making your cat-centered and cat-focused and cat-friendly. And what does that mean? Like, I know we're in this industry now, right? We're all struggling to make appointments and get our calendars full. And cats is that untapped demographic, right? They don't come in until they're dying, and then like,
Yeah.
so what? Any tips for these people that are trying to appeal to cat people, or how can we get more cats seeing better continuity of care?
I think for me, in the way that I run my practice, which is, as I think about growing, I don't know how this will continue, but I spend a lot of time with my clients. We schedule a telehealth call for any new client who reaches out to us, because I want to make sure that we're on the same page. We know what the process is going to be. We discuss the estimate and the diagnostics we're going to do at the consultation, make sure they're comfortable with the plan, so that when they show up, we pretty much already know each other. We can just go straight to taking care of the cat. I think also that one-on-one with owners, cat parents, they really appreciate. And I have a lot of, I have a lot of misses too. Like, I have a lot of people I talk to, and they need to go elsewhere and they don't schedule with me, but it's still so rewarding for me to help people understand and just be that support. That it's hard. And I know in veterinary medicine, I mean, back in the day, I didn't have time. I didn't have the time or the energy to do what I do now, which is why I'm so thankful I've gone down this path, because I think I truly love what I do. So it's very easy for me to take the time. And that translates to long appointments as well.
Yeah.
I will spend
Well,
an
that's what
hour
your
with the
needs,
client.
right? If you're never out of the house and you hide under the bed, certainly
Yeah.
putting you in a cage and taking you to a practice is not what you want to be doing with your day.
Yeah. So it's been great. I only ever have two. It's me, myself, and a tech in appointments. We do everything in the exam room with the client. I don't have any restraining devices. I don't have cat gloves. I don't have muzzles. We do not burrito. It's amazing. I've been blown away I have cats that will just sit. I have windows in my exam room. They'll just sit on the windowsill, and I can place ECG leads on them without holding them. And it's great. We need to get a video in our exam room so that we can record our appointments, because it's amazing. They do so well. And if we can't, we listen. We very much listen to what the cat tells us. All it takes is a flick of a tail within the first 30 seconds of meeting, or a hiss or a growl, and I reach for drugs. I'm able to do that. All of my patients are healthy when they come to see me. So if we can't do it with two people, basically, I love it. I just basically get to hold the cat while my tech, draws blood and does the ECG, and that's it. If we can't do that, we go straight to medication, give them some sedation, get everything done, which I think there's a lot of things I would have to share. But going to Torb, Alfax, IM sedation works wonders, very safe. And I think a lot of cats would benefit from just going straight in the room and getting poked.
Sure.
If you can escort, get away, obviously, but go in, knock them out before they know what's going on. And they're never so smooth.
Yeah, don't give them time to get spicy, right? If we know.
And sedation sometimes I think it can take a little while for them to wake up, but it makes the appointment probably go much faster than doing it the other way around.
Yeah. Slow and drawings. I like it.
Yeah.
It's so refreshing. Megan, you said it, just the intentionality on how you've created this practice, and from day one, you haven't chased the dollar. It's just been so grounded this is who I am. This is how I'm going to build it. And you can see that you just come across as calm, as laid back, and like you're just in the moment of what you're creating. And you don't get that a lot. It's usually in your stage, it's frantic, it's chaotic. I'm sure you have those moments. But I think just your laser focus on who you are and what you've created with Calico, it jumps off the screen here with how you're saying it. How have the clients reacted to that experience? Can you tell like they've just been super engaged and just gobbled it all up?
Yes. They walk in and comment on, I have a very lovely clinic. It's very spacious and it doesn't feel like a clinic at all. So they comment on how nice it feels. I am very low volume. So, there's no waiting room. People walk in and go directly into an exam room. And I have fieldway diffusers literally everywhere, probably more than I actually need. So I think being a busy clinic, which is hard because a lot of places are, and they have dogs present as well. But clients really do love coming and being the center of attention. They have us for the entire time, and it's great. And clients, even after the procedure, when they pick up, say how nice it's been. Time, communication, listening, and really understanding why you're doing what you're. I finally feel like I'm in my career. I remember being a vet student, having a vet come and talk about how great it was and how happy they were, and it was the greatest thing. And I feel like I've reached that point.
So you talked a lot about wanting to make it comfortable for your clients as well. And are they staying? Are they hanging out in your area working while you're their cat getting a dental?
Not really quite yet. We're still in the process of furnishing and finishing the space, but they're here for several hours all day, 7:30 to 2 or to 4. So most people do not stay for that entire time, but I have had people that stay in the area and come back early. I had one couple who came back. We were just finishing and waking the cat up, and I was like, do you want to come see? And they're both like, oh yes. And the mom, as soon as she caught a glimpse of her cat on the table, she had to walk away. She can't, but the dad came and was very interested. It's very open concept. You basically can walk into my clinic and turn right, there are the exam rooms, and turn left, there's the surgery suite with windows. So it's great. There's no separation, which we discussed, Megan, when I was designing the clinic.
No pulling that trigger, no. I don't know. Hey, the only problem with that is if your staff goes feral, right? Well, y'all went a little crazy during COVID, and so
Yeah.
you have to have a staff that is aware that there are people in the building.
We're so small. My current tech, she engages really well with clients. So it's fun. It's just so much fun. We'll see as we grow how that turns out. We can put up some wall separators.
Or just let
Or
them
room
join in,
separators.
right? You can just join it in the fun. We can all have a coffee together, and it'll be great. I love this for you, though. I love how intentional it is. I love this for the community and for the pet parents and for the cats. You had said you had a little bit of like a controversy, hot takes on some dental issues. Do you want to poke into that, or you want to?
Ooh,
I
I
would
like
love
it.
to.
Liver
I
nuts?
like it. I like it.
It's my approach to dentistry is completely different from what it was, when I started in 2014. I always hated having the toothbrush talk with owners. When they would come in for their 2-week recheck, I just dreaded talking about it. And come back in a year, we're going to do this all over again. We might have to extract some more teeth. And that I was practicing with cats and dogs. So, I had large breed dogs that have pretty healthy teeth. They just need a cleaning most of the time. But even a lot of small breed dogs, if you're less than 20 pounds, I think you really don't need those teeth. It's okay to be toothless. It's actually, in my opinion, I think better for them from a health standpoint, from a comfort standpoint, especially as they age. So I'm very proactive with extractions. I do a lot of cotton mouth and a lot of full mouth, which there are cases that definitely need it. I just had a stomatitis kitty yesterday who broke my heart because she woke up still uncomfortable and went to eat and was still ouchy. And this morning, she was eating a ton and she was scratching on her little cat pad. So those cases are obvious when you need to take all of teeth. But I had a client ask, is there any way we can save teeth? And I thought, it's really hard. We can maybe postpone or prolong the time in the mouth, but I have gone through many iterations of this with cats in particular, who I've worked with for over, the past 5 years. I had one client who really wanted to save the teeth and keep them in the mouth. And we would do a cleaning, an exam, and x-rays every 6 to 9 to 10 months. We kept trying to push that interval out. And they came and we got through a long period without having to extract any teeth. But by the time the cat was 7, cost, stress, risk, sure, we can do annual, but I think we would really need to do more frequent procedures to really make a difference, which doesn't really do anything for tooth resorption. So we've already lost that battle. So yeah, I very much promote, if we have to take teeth, if there is one bad tooth on this side and one bad tooth on this side, or even just one really bad tooth on this side, you know, an upper 8, and we have a lower premolar that I know is going to resorb, why are we going to piecemeal and take a tooth here and a tooth there? It changes their occlusion. It can cause new problems to develop. Why leave one tooth at the bottom if you're taking the upper tooth that has no purpose other than to collect plaque and bacteria? It cause inflammation.
That is a hot take, and it makes sense when you say it out loud. I don't know that if we take out that nugget of just pull the teeth, they don't need
Just
that.
pull,
Like,
yeah.
that's not the takeaway.
If there's any doubt, take it out. And if one side is doing something, even if the other side looks great, trust me, it is not going to look great. And I don't want to anesthetize 16-year-old cats with heart disease and kidney disease. I've worked on a 21-year-old cat. There's no reason. And I've had a 21-year-old cat who had all of her teeth. And for whatever reason, however she had remodeled over time, she developed this new malocclusion at 21 years old. I like to keep them to one or two procedures in their lifetime is my goal.
So that's polite, right? I'm sure that they appreciate that. Last hot take, and then because I know we need to be mindful of time. Favorite cat breed?
Oh,
Jared, I know that's a hard one for you.
I'm thinking
I'm not a favorites person. I always tell people I'm not a favorites person, but I've grown fond of ragdolls, Burmese, Sphinx.
Yeah.
I would say those are the 3 that come to mind. And of course, the domestic short hair. Yeah.
The generic orange jerk, right?
Yeah.
The one that everybody loves. Perfect. Thank you, Erin, for all of your nuggets. And I think I'm so happy for you. I know we talked at the very beginning, and you just are doing it your own way, and I love that.
Thank you so much. I'm very happy.
Where can people find you? If people want to know more about your philosophy, what you're doing, how you did it, where can they find you?
CalicoVet.com. You can email us, connect@calicovet.com. We are just entering the social sphere. I've resisted it, but I'm now going that route. So we're on LinkedIn and Facebook. But CalicoVet.com is really the easiest way. And pretty much everything I shared with you is on the website.
Perfect. Thank you so much.
Thank you so much.
Good to see you. Thank you.
Yeah. Bye.